Hi friends, Dr. Nancy Trimbley here, putting the power and knowledge of your health back in your hands, and also the health of your dog. I've done a self-cranial work at home video, and it's one of our most watched videos. And we had a special request to show what somebody would do to help their dog. And it's similar in nature, but the landmarks on their cranium are different. For instance, with humans, you would use the ears to work the temporal bone, and you do the same thing with the dog. You would gently hold on to their ears and just pull straight back. The other thing that's very common in dogs, especially little dogs, is for their nasal bone to get compressed into the frontal bone right here. So the way I work on it, and I'm not certified in cranial sacral therapy. I am not a veterinarian. I am not certified in animal chiropractic, but but I do work on my own animals with the knowledge that I have. So I'm going to try to get Brooklyn to cooperate for just one more second, because I want to show how I would work on the nasal bone. I would put a little bit of backwards pressure here, a little forward pressure there. So this hand here a little forward, this hand here a little backward, and very gentle, just like when you work on your own cranium. So with a dog, what you want to do is separate the nasal bone from the frontal bone here. You can also use their ears to work on the temporal bone, just like with a human, you would use your fingers like this. But with a dog, you can grab both of their ears and very gently just lift up and back. The sphenoid is going to be behind their eyes. It's much more difficult to feel on an animal than it is on a human. We have these nice depressions here at our temples, but it's the same concept. You want to gradually or very gently push forward, not even push forward, but guide that bone forward. Let me see if she'll come back and I can show you. And then the other thing you can do is with the occiput, if you're gonna, what you would do here is lift gently up at the occiput in the back, and you can do the same thing with a dog. Sometimes animals can get their TMJs misaligned, and you might be able to feel that on each side. And also you want to check their hyoid, especially dogs if they've been restrained with a collar. And a lot of rescue dogs have been restrained with a collar at some point in their life. And you want to check the hyoid, and that's moving this bone left and right very gently, very light pressure. Like I say in the cranial video, it's about the weight of a dime is what you want to use on either side of the hyoid bone here. So I hope that helps. As always, putting knowledge of your health back in your hands. Bye-bye.